Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. ECT versus the TMS, that is nothing but the electroconvulsive therapy versus the transcranial magnetic stimulation. So, going by this, first let's look at the ECT. ECT means the electroconvulsive therapy. So, in ECT, the principle is the seizures are induced by applying an electric current. So, the seizures, if you see, they are induced by applying the electric current. So, electric current is used. Next is there is mechanism. So, under mechanism, it includes the neuroplasticity. So, in ECT, there is neuroplasticity, and it also induces the seizures. So, it induces seizures is induced, and it promotes the new synapse formation. So, there is new synapse which is formed. Next, we move on to the advantages of the ECT. So, what is the ECT and its advantage? So, ECT advantage is that it is more effective. There is increase in effectivity, so it is more effective. Then it is a faster response. There is a faster response for this. There is faster response. Then there is a short treatment course. There is a short treatment course is present. So, what are the disadvantages of this? The disadvantage is that it is invasive. Next, it requires anesthesia. So, it is invasive, it requires anesthesia as well as a significant cognitive impairment. So, the significant cognitive impairment is present. Now, let's look at the transcranial magnetic stimulation. So, transcranial magnetic stimulation we look at as the TMS. So, principle is the induction of the eddy currents. So, there is induction. So, induction of the eddy currents. So, there is induction of the eddy current, and this is in the cortex by applying the magnetic fields, and this is present in the cortex, and it is by applying. So, applying the magnetic fields. And what is the mechanism? Mechanism is there is a neuronal stimulation by the eddy currents. There is neuronal stimulation, and this is by the eddy currents. So, what is the advantage of this transcranial magnetic stimulation? The advantage is that it is non-invasive. It is non-invasive. Next is enables focal stimulation of the cortical areas. So, there is focal stimulation. So, stimulation of the cortical areas. Next is there is no significant memory loss. So, there is no significant memory loss, and it does not induce seizures. So, there is no memory loss, which is very significant, and there is does not induce seizures. So, it does not induce seizures. So, these are the advantages. Now, let's look at the disadvantage. So, disadvantage is that it is less effective. So, the TMS is less effective. Then it is a slower response. There is a slow response, as well as there is a prolonged treatment course. So, we look at the treatment, it is prolonged. There is prolongment of the treatment course. To learn and grow daily like this, please do subscribe.